Hello, this is Jean Sachs. I'm the CEO of Living Beyond Breast Cancer. And as many of you know, our goal at Living Beyond Breast Cancer is to provide trusted information and a community of support. And never has that been more important than in these very uncertain times. Today, we're going to talk about managing the stress and anxiety of living in our changed world with COVID-19, and then also living with breast cancer. We know that's a double whammy. Many of the things we're facing with COVID-19, applying greater vigilance to our body, feeling like we lack good evidence-based information, not knowing what the next day may bring, and feeling less and less control over how to just to carry out daily functions, whether it's food shopping or taking a walk or running to the pharmacy. So at the very beginning of the shutdown, at least when we were shut down in Philadelphia, we reached out to Dr. Pam Ginsberg, a licensed psychologist, to talk about stress and anxiety. And we got a lot of feedback that those interviews were extremely helpful. And I can't believe that it's been almost 2 months, but we wanted to bring Dr. Ginsberg back to continue the conversation. So welcome, Dr. Ginsberg. And again, thank you for being here.
My pleasure. Great to see you again.
Great to see you. So before we start with the questions, tell us how you're doing.
I'm doing okay. I'm here with my family at home, and I'm doing all of my sessions versus via telemedicine. And so I'm still pretty busy and doing well.
Okay, that's really great to know. We want everyone to be doing well and healthy. Can you give us a sense of what the social distancing and the change in how your patients, get to interact with you, how is that impacting them?
So I'm seeing, a couple of things. It's interesting because I think this is the 9th week of basically the shutdown. And there has been like an evolution, which is interesting because it feels like we're sitting still, but really there has been an evolution. And I see a couple of things. One of the things is I see like this weariness that has set in for a lot of patients. And at the same time, I also see a settling in that's happened where people are just kind of, adapting. They're settling into their current situation. And it doesn't feel the situation itself doesn't feel quite as frightening as it did at first when we knew so much less.
That's really interesting. I think you're right. Well, for those of us that, are able to stay home, which we know is not everybody, I think we are sort of adapting to every day this is what it's like. But we also know for those people that have to continue to go out, and particularly those who have to continue to go to treatment. And so you talked about some of the changes of people settling in. Are you seeing anything else, particularly for those patients that might be actively in treatment or maybe having a new problem?
I think for the patients who are actively in treatment, there is also a settling in that's happening, settling into the routine of their treatment. And again, this adaptation of going into a treatment center, going into a medical setting with gloves and masks and seeing everybody with gloves and masks. I think it was it still is eerie in some ways. People are using that word a lot. It feels eerie to them. People I'm in the Philadelphia area, people going into their treatment centers in big cities and feeling like the city is empty. That feels strange. But again, people, human beings are really good at adapting. We get used to things. And so people are adapting to that. For those who are having new problems, I think that's particularly scary because people who may have been kind of settled in for a while and are having a new problem now have to deal with managing how to see their treatment team and how to see them differently. Using telemedicine, as I know and is not exactly the same as going in and seeing your doctor. And even when you are going in and seeing your doctor, you're seeing him or her differently because they're masked and you're not quite getting the same kind of information because of that you would normally.
Yeah, we did talk to a doctor last week who said her patients don't know that she's smiling because she's wearing a mask. Mm-hmm. Are you finding for the therapy sessions you're doing, Are most of your patients wanting to use the camera with Zoom, or are some opting for just a phone call or audio?
I'm definitely getting both. I think more people are using the video option. There are, I use a HIPAA compliant video platform that's not Zoom. And so most people are using that. But there are many people who just are not comfortable with it for whatever their reason is, and it's fine. And so we do telephone sessions. And again, you don't quite get the same interaction on the phone because you're not seeing these facial expressions.
Right. I know for some people though, the Zoom camera, because we really are looking at a camera, and it's a little, it can be a little, just disassociating.
Yes.
Sometimes the phone, which feels more familiar, has been helpful.
Yeah.
So I just want to talk about sort of short-term coping strategies and then longer-term coping strategies, if you have some thoughts of some things we could do right away and things we should be building or flexing our muscles to use.
So in short-term coping strategies, they're often the same as what we've talked about many, many times. Things like getting outside, exercising if possible, going for walks, certainly connecting with your friends and your family, and making sure that you're not even though we're social isolating, we don't need to be isolated. And so finding ways to connect. I have a lot of patients who are doing Zoom bridge games or mahjong games, any way that they're having kind of normal interactions and conversations that don't completely center around COVID-19. So eating right, sleeping well, watching your alcohol intake, all of those normal coping strategies. Long term, I've been telling my patients, this is the perfect time to experiment with some things that you may not have done before, like learning how to meditate, or trying yoga, or some of the things we talk about often, but take some time and effort to really develop. And so I'm really encouraging people to allow themselves to experiment with some, especially meditation. I talk about meditation all the time as one of the most important and effective strategies for reducing overall levels of anxiety. This is a great time to learn how to do that.
Yeah, and there are so many, we talked about this last time, but so many free apps, a lot of companies that have waived their fees. So encouraging people to take advantage of that. And I have talked to a number of women impacted by breast cancer who have been using this time to sort of get their nutrition in order, since they're eating home. So you have a lot more control. So it is, you're right, there are those opportunities.
Yes.
So we know human beings don't like to live with uncertainty. We want to know what comes next. Just like when you're on the plane, you want to know, fasten your seatbelts, and when are we going to take off in 20 minutes or 4 hours?
Right.
So now I think we've all realized uncertainty is our normal. And are you seeing that as impacting people's, long-term mental health? And again, what can we do to get comfortable with living with uncertainty?
You're right. Uncertainty is one of the most difficult things for human beings. And I think that there's, we always live with a certain amount of uncertainty. Cancer patients specifically live with a higher amount of uncertainty. And now when we add COVID-19 on top of all of that, there's even more uncertainty. And there's a tremendous amount of uncertainty around this particular virus. In terms of how long it will take and how long we need to do this and what this means for us in the long term. So, we as humans are also very good at managing acute stress, short-term stress, but chronic stress is more of a problem. And I'm seeing this uncertainty as more of a chronic stressor at this point, where we don't quite know how to get ourselves comfortable here. I think that we have to accept a certain level of discomfort, and that we can learn to adapt and tolerate the discomfort a little bit, because the uncertainty isn't really going away anytime soon. And again, there's this kind of settling into it that I'm seeing at the same time as people are weary from it. They're weary from the not knowing. It's hard, but Us being able to talk about it with each other, with our support system, with our cancer community, being able to chat about it has been really important to my patients. Because in the cancer community, there are certain stressors and concerns that are unique to them, as that's always been the case within this environment where we're all feeling the uncertainty.
Yeah. And I think the difference is we're all feeling it. So nobody's exempt. And I've certainly talked to a lot of people who are also just starting to feel bored,
Yeah.
and unsure how to fill their time. So
Right.
what are some of the triggers you're hearing in your practice? And then what can we do to avoid being triggered?
The triggers, for the cancer patients are often the same. It's going into, getting scans, getting treatment, any kind of physical symptom that they're feeling. Those are the same triggers as what they've always had. They just mean something a little bit different right now, because there's these additional fears and worries that are sitting on top of the normal cancer triggers and worries. What's really important, I think, for people to understand about triggers is that we don't have a lot of control over what happens to us emotionally when we are triggered. So it's really important to understand what your triggers are, so that you can almost expect them when they're predictable, because that helps us. That gives us some level of control when triggers make us feel completely out of control. So knowing what the triggers are, understanding what a trigger is, and then having a strategy for once you're triggered, what do you do about it? So the breathing exercises, or phoning a friend, or talking to somebody in your support team to help you just kind of work through how you're feeling. But we don't have a lot of control over how we feel when we are triggered.
Right. And I know sometimes we don't even realize that we are anxious. So what are some of the physical, emotional things people can be more mindful about? I know for me, sometimes I have to, my neck will start hurting or something will and I'll have to say, okay, wait, what's going on? So
Right.
what are some tips for that?
Being familiar enough with your own body and the way that you respond to stress is a really important piece of information, or several pieces of information. I'm hearing a lot of people who are having increased sleep problems.
Mm-hmm.
And I think that's due to a lot of things. I think one of them is certainly increased anxiety. It's making us more agitated, and that affects our sleep. But I also think our routines are just so disrupted right now, that the things that would normally kind of help us to relax, to go to sleep, we're not engaged in as much. We're tired and fatigued, but not in the same way that we normally are. We're not tired and fatigued from activity. We're tired and fatigued from boredom, and that affects sleep in a negative way. So a lot of people are talking about sleep problems. Some of the other things, obviously, like muscle fatigue, that's something that's very common with recognizing anxiety. But most people just talk about having that feeling, that feeling in their gut that's uncomfortable for them. And what I, always recommend is, once you recognize that you're having a problem with anxiety, don't just sit there with it. Don't let yourself just soak in that feeling. Get up, go do something, get outside, go for the walk, call a friend. There's a lot to be worried about right now, and we can't just let ourselves sit in the muck of that worry and expect that we're going to be okay.
That's great advice. I realize the days are longer because you're not getting up or commuting. And so make your to-do list, but do it in the order that you can do it, which might mean a break in the middle of the day or things like that. We also know that this pandemic is causing a lot of financial stress, and a lot of people are worried about their personal financial situation, maybe being able to take care of themselves or their family members. So wondering, are you seeing that in any way to sort of help people manage that very real anxiety?
Yeah, this is such a multi-layered problem, isn't it?
Yeah.
The pandemic and the cancer and the everything that goes along with all of the changes, including, and very significantly, the financial stress and the worries. People who have lost their jobs may have also lost their insurance.
Right.
And so there are real problems there. And what I encourage people to seek help. One of the antidotes to fear is fact. So it's really important to get information. A lot of people feel reluctant or hesitant to call for help in these areas, help in either understanding what it means for them and what's available to them, calling maybe a financial, their accountant, or even, the government, trying to get through to unemployment or anything like that. It's all very difficult. But the more you get information, the more you know what to do, and that helps us to feel more in control again. So seeking information is really, really important. I wish I had the solution for the financial problems themselves, but getting information is really critical here.
Yeah. And Living Beyond Breast Cancer has been providing a lot of resources. And I think the positive news are that there are a lot of resources out there. So we do encourage people to seek them out.
Yes.
So my last question just really is around the change in social behaviors we've all experienced, going to stores wearing a mask, not knowing how to greet someone, not knowing how close you can get to someone. Is it 6 feet? Is it 10 feet? And kind of the anxiety and just awkwardness that we're all experiencing out in the world. And then also this concern that if people aren't following the rules, are we being put at risk? And I know for the cancer community, and certainly depending on where you are in the country, it is different. So that's a lot of information, but I think you know what I'm saying.
Yeah. What we know is that there's no such thing as no risk. So we really have to think about it in terms of low, medium, and high risk behaviors. And it's critically important to understand that you do not have control over other people's decisions and behaviors. You have control over your decisions and behaviors. And so I want each person to think about what their own decisions are about where their comfort is in terms of low, medium, or high risk behaviors. We can all kind of figure out which behaviors fall into which category. For those who are really, who have that are immunocompromised and are in active treatment, I'm really strongly encouraging staying in the low risk behavior as much as you possibly can. That's within your control. If you know that there are people around you who are engaging in behaviors that are medium or high risk, you want to stay away from those people. So know what's within your control and what's not within your control, because it's incredibly frustrating to see family members or other people in your life or just in your community who are engaging in behaviors that you think are high risk behaviors, but we don't control that.
Yeah, and that's a good point. We can only control what we can do, and I know there are many people living with breast cancer who are really staying very secluded,
Yes.
and fortunately have other people that are shopping for them and getting their basic needs. And when they go to the hospital is really the only time they're going out. So that's so helpful. I know we talked about sort of ending this with a really short meditation practice. I'm happy to do it with you. And I thought that just might be a gift we could give to our viewers.
Sure. We can do a breathing exercise. So my favorite breathing exercise is something called 4-7-8 breathing. And it's just a simple breathing exercise that activates your parasympathetic nervous system, which is the rest and relax part of your nervous system. So this is a great little tidbit. This is a great little thing to do when you're having trouble falling asleep, or when you're feeling particularly anxious, when you're about to walk into your treatment center, to take 5 of these 4-7-8 breaths, and it just kind of calms your system down a little bit. So quickly, the way that we do that is we breathe in for a count of 4 through your nose, you hold your breath for a count of 7, and then you breathe out slowly for a count of 8. And we're going to do that 3 times. So I'm going to count and you're going to breathe.
I'm ready.
Okay. So breathing in through the nose, holding, and then breathing out through the mouth. Ready? Mm-hmm. Okay. And here we go. In, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Out. 2, 3, 4, 5, 6, 7, 8. In. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Out. 2, 3, 4, 5, 6, 7, 8. Now let your breathing come back to normal. How'd that feel?
Amazing. Yeah. It's incredible that breathing is really important, and we lose sight of that.
Yeah.
So thank you.
It tells our brain to calm down
Right.
when we breathe slowly like that.
Yeah. I think we all have to keep remembering us being anxious is not going to help the situation.
Mm-mm. And over worrying doesn't help, and worrying about what could or might happen in the future doesn't help. If we are present and we remember that right now in this moment we are okay and we are controlling what we can, it just kind of settles ourselves down a little bit.
Yeah, it's so helpful. It's so simple, and yet we're so wired not to follow that advice.
Yes.
Well, Dr. Ginsburg, it's always a pleasure to spend time with you. So thank you so much. And thank you. And then to everybody who's watching, just remember Living Beyond Breast Cancer is updating our content every week, if not every other day. We have closed Facebook pages, so please go on to our website, lbbc.org, and join. We also have a helpline answered by all volunteers for peer-to-peer support. So lots of ways to get immediate support, and we hope you'll take advantage of them. So we're in the middle of May. I'm hoping everybody stays strong and stays well and continue to stay connected to Living Beyond Breast Cancer.